Hey everyone, Mattu here, and I am with...
Tristan Miller, that's me. I'm an actor, stand-up comedian, and podcaster.
And mental health advocate.
Yes, thank you for also saying that.
I wanted to do an episode about the top bipolar depression myths.
Yes.
And I thought you'd be an awesome person to have on to help me out with this.
Well, I appreciate that. I am an expert in as much as I live with it every day. So there you go.
Talk about it and do stand-up comedy about it.
Yeah.
So let's do that. Yeah. Well, maybe comedy.
Okay, so
yeah. What's your first one?
The first one, and this is one that I remember, it comes from a personal instance, that bipolar means you're just angry. It also means that you're anxious. It also means that you're hyperactive sometimes and irritable because it feels like everything's going too slow. And it means you're going really, really fast or you're really, really slow. And those are the two ways I like to define it, because slow can mean depressed, but it also can mean anxious or just kind of catatonic.
For some people, it might not be anger, but it could be like irritability, like easily being emotionally set off.
Yeah, and when you have those ups and downs during the day, they're generally based off of external factors and not the disorders, like, oh, you had a bad day, but you were feeling great, or you haven't eaten or drank enough water that day, and your body is like, do something about this,
Yeah,
please.
That's another one that I had, which is bipolar disorder explains all of your emotions.
Yeah, I think everybody experiences every range of emotions, no matter whether or not you're mentally ill. Like
right.
People feel things. That everybody feels things.
Does that happen to you? Are people like, oh, are you just saying this because, or are you just feeling that because of bipolar?
People don't necessarily attribute that to me, but I know I do. I look at my own feelings and I'm like, are you actually mad, or are you doing emotional reasoning?
Yeah.
Are you feeling something and trying to tack it on to something? I feel like neurotypical people don't question that. They're just like, oh, I'm offended, whereas I have to go, am I actually offended? Am I feeling too good, or am I just in a good mood? But sometimes people have gone, look, man, are you actually upset, or are you just like, what's going on? Are you actually are you sad, or you're sad about this movie, or are you just feeling down? And it's like, I don't know. And that's hard because it kind of gaslights you to question everything. And that kind of goes into something kind of that's linked in my second one, and it is that we're all like abusive, or that we are emotionally manipulative. We're sensitive people. We're sensitive. We're sensitive people. And I think that's the main common denominator between all people that I've met with bipolar disorder. They're very sensitive and they get hurt really easily. Trying to get something out of somebody by saying, oh, I'm sad, or oh, I feel great, and you should be on this journey with me, either way. That's not the case. We just are experiencing things like normal people do, and when anybody experiences anything, they want empathy. That's our whole drive as a species, is like, we want other people to feel with us.
How I describe it to folks is, imagine being a third-degree burn victim, and you're in a hospital, and the window's open, so there's some wind coming in. No one else in that room really notices the wind, but if that layer of protection that your skin is supposed to be, if that layer is not there, you experience that wind in such a severe way, and it's quite painful. So a lot of folks with bipolar depression, they feel and experience things more intensely than other people might.
There is a certain beauty of being that sensitive, but it also is a pain in the ass. Because it is one of those things of I've cried about forgetting to shut a fridge door once. That's not normal. You shouldn't romanticize it, because it's an illness, it's a disease, and you gotta treat it like it could kill you, because it could.
The idea that it's your fault,
sure,
that's a huge myth.
Okay.
So it's
Goodwill Hunting there. Don't do this to me, Doc. Right. Don't do it.
It's a very biologically based problem. It does run in families. There's a strong genetic component to it. It's not your fault that you're experiencing it. It's your responsibility.
Yes.
You have to figure out how to deal with it and cope with it.
It is absolutely up to you to own up to what has happened in your life, what is happening in your life, and reform your life so you are happy and healthy, and the other people around you are too. The next one I have is that we should all be on medication. Medication can be a tool, but it's just one tool in a box of many. You should have a big old tool chest. For me, I take anti-anxiety medication when it gets really, really bad, but never when I don't need it. And I think that's something that should be championed more because it is about finding a right fit rather than everybody should be on lithium. That's
Totally.
Everybody should be on a mood stabilizer because some people are fine and some people aren't, and you gotta whatever makes you function the best.
What goes along with what you're saying too is there are therapies that work.
Yeah.
You know, like it's not just about medication as the only treatment for bipolar disorder. Cognitive behavioral therapy, dialectical behavior therapy.
The way I say it in my set, it's like having the oatmeal variety pack of mental illness. Of like, because every day you're waking up, what's the flavor? Oh, it's intrusive thought syndrome. Oh, it's chunky, what are the chunks? Bad thoughts, that sort of thing. Another one I have is that we're dangerous people. As a community, we're kind of viewed as unpredictable, which is understandable because at a certain point we are. Once again, it's that sensitivity. A lot of us are really kind and we try and do good things. We're not all mean.
Yeah.
We're not all mean, Ollie.
No, I know, you're super nice. Oh. People who experience mental illness are much more likely to be the victims of violence than those who cause violent acts.
The next one I have is that we're just depressed because people don't, I think in general, don't know what bipolar depression is.
What is bipolar disorder, Tristan?
I think Carrie Fisher put it so well. It's going really, really fast and then being really, really sad. A lot of people think it's happy and sad. It's really, like I was saying, it's really fast and then slow. You have slow days and you have fast days. And some days the slowness is because of congestion and traffic of your mind where things kind of just drip out. And then other days, everything pours out. That's another metaphor she came up with. It's a faucet, an emotional faucet. And either it's open or shut. Your personality is still there, even when you're up and down. You're like, there's that whole thing, you are not your illness. It informs who you are, but you're not it.
That gets into one of mine, which is Mania feels good.
Yeah.
It's a fun,
it's a ride.
It's great.
Generally, I've found that people with bipolar disorder don't end up in the hospital when they're depressed. They end up when they're up and they've had a psychotic break. Once again, Carrie was really open about her experience of like she went to a mental institution because she thought the walls were talking to her. That's hard. That's not fun.
Yeah.
No one likes that. No one likes being delusional.
It's scary.
It's really frightening.
Yeah.
And this ties into the next thing I have, and this is once again for people who have bipolar disorder of like hypomania is sustainable as a feeling because hypomania tends to be a little bit more euphoric, I think, and a little bit more productive because it's not as debilitating. I know there have been times where it's almost like an addict of like, I just want to get back to where I feel creative and I feel happy and I feel good about myself, which is so hard because it's not sustainable. It'll go away every time. The key to being successful with living with this illness is when you aren't in those episodes, how do you deal with your life? Patton Oswalt was talking about his experience with antidepressants, because you do as an artist, and if you're an artist and mentally ill, you do think that it kind of comes from you, and that's actually my next one, is that the disorder is the catalyst for creativity, where he has spoken very openly about like, once I was on medication, thoughts came easier to me. I didn't get in my own way. And so if you can step to the side and let that thing out, and whatever makes that easier, if it's medication, if it's therapy, if it's doing more things, and keeping active, being creative, just do it.
What questions do you have about bipolar disorder? What myths have you experienced? Let us know in the comments below. Where can people find more of your awesome, amazing, healing, funny work?
You can go to tristanjmiller.com.
And you've got a YouTube channel too,
yes,
where people can check out some of your stuff. I'll put a card right over there. Click on that card, check out.
Beautiful.
Yeah, I know. I know.
You did really good work.
Yeah, thank you. Yeah, I programmed that myself. Yeah. Thanks for being on the show, Tristan. We're gonna do another episode.
Oh yeah.
Yeah. It's gonna be about how to cope with bipolar disorder.
Yes.
Yeah.
Which I think that's almost more important.
Yep.
In a way.
Yeah, but we can say that now because you just watched this whole video. But
gotcha.
check out that video and see you soon.